Hello and good morning, everyone. Kevin, any comments before I get started?
No, thank you for joining us. For this presentation, we have Kate Talbert and Francesca Charles, who are going to be covering our newest tool here at CRISP, the Clinical Reporting Suite. So I'll go ahead and turn it over to you, Kate.
Thanks, Kevin, and good morning, everyone. It's great to be here and to be talking about this work, which is new for us at CRISP. We're so excited to share a little bit about what we've been working on and a demo of one of our newest reports. My name is Kate Talbert. I'm the Director of Reporting and Analytics at CRISP Shared Services, and I am joined by my colleague Francesca Charles, who is our Clinical Reporting Project Manager. Today, I'll share a summary of our work to create population health reports using CRISP clinical data, and Francesca will give a demo of our latest hospital revisit report. Okay, next slide. Okay, so a bit of our history. For many years, CRISP has hosted reports that assist users to manage the total cost of care, utilization, and health outcomes of the populations that they serve. Since 2016, the CRISP Reporting Services portal has grown, and we now host hundreds of reports for this purpose. Historically, these reports have always used claims data. So whether that is hospital case mix data through the HSCRC, Medicare claims, or Medicaid claims. Because claims data has been through an adjudication process, it's typically very standard and clean and final, making it ideal for measuring and reporting on cost and quality across different healthcare settings. And that's been the primary reason that we've used this data for reporting to date. However, claims data also has its limitations, as many of you know. It is often delayed by weeks or months after the date of service, and it may only represent claims from a single payer, such as the Medicare or Medicaid data. And it also can lack richness that you would find in an EHR or through clinical information. Data being shared with CRISP by healthcare organizations, so including admission discharge transfer or ADT messages, continuity of care documents, labs, and other types of data do present an opportunity for more timely and clinically rich population health analytics. So if you go to the next slide. So for that reason, knowing we have the wealth of clinical information within CRISP, we've had a goal to build on our experience providing claims reporting in CRS. And we've been working with our data insights team, users, and stakeholders to identify use cases for presenting HIE clinical data in dynamic dashboards, such as the screenshot you see there. We've spent the last year building the groundwork for this vision. And next, I want to share a little bit about how we've done this. Okay, so our goals for this year for clinical reporting were really threefold. First, we wanted to gather input for potential report use cases, talking to users, and we wanted to develop the first reports and begin giving access. We started with stakeholder input. So that meant we had to sort through the requests we've gotten for data over the years that claims could not support. And we've also been looking at stakeholder priorities, such as the priorities for the state and kind of future models, and have been convening a roundtable of population health experts across different state health information exchanges. Next, we leverage the analytics capabilities of our data lake and data insights team. They spent time examining the quality and quantity of data available and developing data sets to support the dynamic reporting use cases and reports. And lastly, we've had a goal to increase access to the tools beyond the initial pilot users who we've provisioned this year. We've built on the access framework of CRS to make clinical reporting available for assignment by organizational points of contact through both our HIE admin and tool along with Role Manager. Hospital and primary care users with a panel will soon be assigned the tool within their HIE portal. If you go to slide 5, thank you. Before we share a video of the demo of the hospital revisit report, I want to share a preview of what is to come for future clinical reports and talk about a little bit about what we've built to date. First to mention, in addition to the hospital revisit report, which you're going to see, We've also created a panel demographics report. This report allows users to see a view of the demographics and chronic conditions for patients on their panel. We've also developed two program-specific reports called IMHS. These reports are for individuals at the state and agencies who are responsible for tracking referrals for high-risk maternal health patients. We have two reports planned for release this summer focused on diabetes using hemoglobin A1C and other lab data. And we have a skilled nursing facility length of stay report that uses ADT message from skilled nursing facilities to calculate patients' lengths of stay in those areas. We also have plans to create additional reports this year, including a social determinants of health screening and referral report and reports to support the rural health initiatives in our state. I will say before we just jump into the demo, we do have some contacts for more information about clinical reporting. We can put those emails in the chat. We also have user guides, which are being posted to our CRISP website, so folks can learn more about how to navigate their reports, the methodology, and who can access them. I'll go ahead and put the links to the emails in the chat so that folks know who to contact for more information. And now I'll turn it back to Kevin and Francesca to share a demo of the hospital revisit report. Thank you.
Good morning, everyone, and thank you for joining today's session. My name is Francesca Charles, and today I'll be providing a brief overview and demonstration of the hospital revisit report within clinical reporting tools. This report is designed to provide insights into the hospital revisit trends and utilization patterns, helping organizations identify opportunities to support care coordination, monitor patient outcomes, and better understanding of hospital revisits, utilizations across patient populations. During this demo, I'll walk you through the report layout, key metrics, and examples of how data can be used to support operational and population health initiatives. Users with access to the HIE portal can access clinical reporting directly from the dashboard by clicking on the Clinical Reporting Tools tile. Our available reports are panel demographics, hospital revisits, and upcoming reports are diabetes, prevention and control, as well as the skilled nursing facility length of stay. For the hospital revisit report, users are able to track patients who have returned to the hospital within a defined time frame after an initial visit. This helps identify patterns in readmissions and supports strategies for improving care transitions and reducing avoidable visits. Within the main dashboard, users are provided with a series of static tiles that highlight the total initial hospital visit, the hospital revisit rate, the total hospital revisits, and the total patient count. In addition, there are filters that allow for the analysis of targeted populations. For example, if you would like to select a specific initial hospital visit, users would have the opportunity to refine their search by initial hospital visit, revisits within 2 to 30 days, long-term care facility names, and discharge dispositions, as well as revisit patient class. There are some demographic filters that allow for users to filter by race, ethnicity, and age group. Within the body of the dashboard, the charts that are provided are the revisit rate um, chart. The revisit patient class percentage chart is presented as a pie chart that offers a unique perspective on the distribution of revisits across the three patient classes. The patient count by number of revisit chart represents the number of patients who have a specific number of revisits within the selected time frame or the last refresh date. The revisit rate by initial hospital and the revisit rate by long-term care facility charts allow for users to identify the rates by initial hospital as well as long-term care facilities. And the initial hospital discharge disposition will provide details on the disposition of the beneficiary once discharged from their initial hospital visit. At the very bottom, we have a patient revisit details card that provides information on the patient ID, the initial hospital by patient class, the initial hospital admit date, hospital discharge date, and initial hospital length of stay. In addition to the charts, the filters, and the static cards, all of our reports contain a data dictionary that provides users with terms and definitions that are used within the report for better understanding of the data. Additionally, organizations will have the ability to select panels through the multi-select panel selection. To clear all filters that have been selected, we have a clear all filters button that users can use to remove and return to the default state or status of the report. For users who are interested in receiving access to the hospital revisit report and any other clinical reporting tool, please feel free to reach out to your organization's account manager or reports role manager, POC, or HIE admin for access to the clinical reporting tools. Thank you.
Thank you for that, Francesca. I know you were answering some of the questions. I don't know if we want to also answer them here. The first one, would the revisit chart encompass any and all hospitals within a time period?
Or would you like me to take that one, Francesca? Or do you have it?
Sure, I did reply in the chat to that question. The report
Oh, great.
currently looks at a 2-year look back. So any visit within that time frame would be captured if shared, of course, with Chris.
And then does the hospital revisit report include any psychiatric admissions?
I can take that one. To the extent that data is shared with CRISP and is not considered 42 CFR Part 2 eligible, it would be included. If that data is 42 CFR, it would not be included here.
And then someone's asking about maybe some use cases of the report. Like, do we think this will drive any discharge planning?
I can take that one, Kate. I think so. It can absolutely help drive to improve discharge planning, especially when the revisit patterns are actionable and timely.
That's all the questions we have so far in the chat. I do want to apologize to folks if the video came across blurry. It wasn't on my end, but we will absolutely put the video on YouTube for you to review after this session so that you will have access to that great demo. Um, Francesca, do we want to talk a little bit about our rollout plan in Maryland at all?
Sure. So we are currently allowing for our reports role manager application, which is currently being leveraged to credential users access to our existing CRS reports, which Kate mentioned earlier in her presentation. And so we have officially integrated clinical reporting with reports role manager. And so organizations can now um, reach out to your account managers, your POCs, request access to this new application. Clinical reporting tools is how it will appear on the user's dashboard. The POCs will be able to utilize the reports role manager to credential access to the existing report. So we currently have two reports, actually four reports that are live, and we have two upcoming reports, the diabetes prevention and control, as well as the SNF length of stay. We've initiated a launch of 200 organizations, so it's quite possible that your organization has already been credentialed with the application, and so it's just a matter of reaching out to your HIE admin slash reports role manager, POC, and or your organization's CRISP account manager. Additionally, Kevin, I know you were just about to say this, but we are hosting webinars. We held our first webinar training session for our POCs yesterday. We do have a webinar scheduled for this Thursday and next week after the holiday on the 27th. Thank
Awesome.
you,
Yeah.
Kevin.
And then I think we're going to plan some webinars that are not scheduled yet for end users when they get access in June. So look forward to that as well. Any closing thoughts, Kate or Francesca? I know it's been a huge effort for the team to allow for this new type of report to be shared, and it's kind of out of the realm of just the claims data that we've been working with. So great work to your team. Anything you want to leave the audience with?
I will say that just because this is a relatively new project and undertaking for us, we are very open and receptive to user feedback on these reports and tools. So please, to the extent that you get in there and start using them, reach out to our team, share your feedback, your suggestions, talk to your account managers. We are very much looking to make sure that these are helping with the discharge planning question, all of the questions around how clinical data can be most useful for providers and organizations. So please give us your feedback, and thank you so much today.